Hello and good evening, everyone. Thank you so much for joining us tonight. Tonight is going to be a very important night for all of the GP trainees. So, if you are preparing for your AKT soon, or if you are also preparing for your SCA, today is going to be a very, very important and a very lucrative day for you today. Today is the ultimate GP exams success guide. We're going to get you through very important details that are very, very required for you to pass your AKT and to pass your SCA in a very professional and a very expert way. My name is Dr. Khaled. I am one of the UK GPs, and I am here in presence as well of Dr. Omar. Dr. Omar, he is a very well-known doctor. Dr. Omar helped a lot of doctors passing through the AKT exam. He actually helped them a lot to pass, specifically from the first attempt, to pass with flying colors. We have Dr. Omar tonight and me as well, and we're going to talk to you about ultimate important ways or how to pass, how to ace your GP exams in a very, very perfect way. So let's start with Dr. Omar. Dr. Omar, how are you doing?
Hi, Dr. Khaled.
Hi,
Can you
how
hear
are
me?
you? Yes, I can. I can. Thank you so much. Thank you so much for joining us tonight. And now I'm going to leave the mic with you. I'm going to let you actually share your presentation. Thank you so much for joining us tonight.
Thank you, Mr. Khaled. So just to check how many person here still did not have his AKT done. Is there any people can just share in the chat? Hi, Dr. Sam. How are you doing? Long time not talking to you. Good. So, okay. Yeah, just to make sure that people will get benefit from what we are going to talk about. So let me share the. So people, just can you confirm, Dr. Khaled, people can see the presentation on the screen?
Yes, Dr. Omar, I can see it
Yeah,
myself, and hopefully
yeah,
everyone. Thank you.
thank you. Yeah, so just it will be quite quick and brief presentation. Just let people have some insight about how they should get prepared for the AKT. So I have been helping people to pass AKT for almost 3.5 or 4 years now, and uh, I'm always updating and changing the approach how I teach the people to make sure that if there's any negative feedback or something, always we take that in consideration to make sure that we are doing what the people will get the maximum benefit from. So just introduce myself. So I believe a lot of people heard about me. I am not young. I graduated 2005. I have almost 20-year experience in GP. Maybe I'm not the same like a lot of people joining GP training recently. I have a passion in the general practice and family medicine. So I choose this specialty. I did not take it because I have to take it. I picked up the family medicine and general practice because I like it. I worked in the family medicine for, as I mentioned, almost 20 years now. So I believe that experience in the GP give me a lot of, background that allow me to help people and share the experience and even teaching. I have been teaching since 2008 on multiple levels. So I believe that uh, Allah gave me some skills about that. So I'm trying to utilize that. So as people can see, I had MRCGB, the UK one, or CCT done here after finishing the training. I got the MRCGB International long time ago, 2014. I registered with PLAB. I have AMC, Australian Medical Council exam. I'm fellow of Royal Society of Public Health. I have a master degree in infection control and epidemiology. So I did loads and loads of exams. And I believe this is one of the things also that gave me what we call the technique of the MCQ, which is one of the essential skills that you should have to pass the AKT. So simply speaking, we are going to get some basic points, what people need to pass the exam. Either you will join me or you will do that on your own. I'm just going to give facts today, and people can utilize these facts and this advice through whatever the way you would like to use to pass the AKT. So what will be required from you in the day of the exam? Two main things. If you have strong, solid medical background, it's quite good and perfect, but it's not enough on its own. If you have good exam technique, but don't have medical background or not medical knowledge, require medical knowledge, it's not enough on its own. So you have to combine between both of them, okay? So people should be able to recall the information, should be able to have the required base and knowledge to be able to pass the exam. It's not important for AKT only, it's important for SCA and for your day-to-day practice. I would advise all of you to use AKT exam preparation as a good chance for you to build up your knowledge, not for the exam only, also for your day-to-day practice and your future, to be a good GB, okay? Exam techniques, it depends on two main things. Types of the question, how to approach each question, and how to do the question in the right time, okay? So let's go with the medical knowledge. For exam technique, there was one session I did before about the MCQ techniques, how to improve your techniques. I will share the link with Dr. Khaled, and he can share that with people so people can approach it. And because it's about 40 plus minutes on its own, so I will share that. Will not waste time in that. There's a lot of tips and tricks in that. Regarding the medical knowledge, from where you should build up your medical knowledge, there are many resources, by the way. And as I mentioned, it's totally up to you which resource you would like to take. So there's something called the AKT feedback report. It's an essential resource. After each exam, RCGB publish report. This report will show the passing rate, how many person attended the exam, what was the passing score, and many other information. The most important thing in this AKT feedback report is you have to learn how to read it, okay? So you should not waste your time reading about these numbers, just go for the area where the candidates struggled at, okay? Because this is the area they will keep testing. After each exam, they will highlight few areas at which the people scored quite low. And as long as these areas are not improved, they will keep testing that. So I did also some summarization of the AKT feedback report of almost the last 5 or 6 years. This is something also I can share with people. If you are going to study and prepare on your own, it's totally fine, but just make sure that you will go through this list, and every topic and everything in this AKT feedback report you should be aware of. Why? Because first of all, these are stuff appeared in the exam before based on the AKT feedback report from the Royal College. And secondly, it will be frequently tested, okay? So this is one thing which is essential. This is essential, okay? Then you have something called RCGB condensed curriculum. This is the curriculum that you should cover. Definitely, it's massive. If you go through the list of the content, it will be, if I'm not wrong, something around maybe above 80 or 90 page or something, maybe something more than that. So it's too big, but this will give you insight anyway, because it will give you each part of the curriculum and what is required to be covered for AKT, what will be required to be covered for SCA, how you can apply that in your day-to-day practice, and so on. So it's quite important. So for example, you'll find chapter for the allergy and immunology, chapter for cardiovascular cardiology. I'll check if I have any file of this I can open and show that to you after I finish the presentation. This is something good for you, even if you are going to do the preparation on your own. Why? Because the most important thing to know what you need to cover for the exam. So you need to go through this condensed curriculum if you will be prepared on your own. So each topic in this list ideally should be aware of, okay? And definitely the NICE CKS and NICE guideline, it's another source, and one of the ways of preparation, people go through the NICE CKS and NICE guideline and try to summarize it. I'll give you some quick tip. I'm not sure if a lot of people are aware of that or not. So there's NICE guideline, not the NICE CKS. CKS is the summary version of the NICE guideline. So there's something, the NICE guideline itself, always search nice guideline, visual summary of the topic, okay? So again, this is something available on the nice guideline in the tools available with the guideline. And in most of the guidelines, you will find something called visual summary. Visual summary, this is a summarization of the topic in picture version, okay? So you'll have that for hypertension, you will have that for heart failure, you'll have that for the asthma, you'll have that for loads of topics. So I would advise you to do that. It will save a lot of time for you in your preparation and in your summarization, okay? And always, nice CKS, this is something that you will use in your day-to-day practice. I always advise people in their day-to-day practice, if they have any patient, for example, complaining of or coming for diabetes, coming for nerve pain or neuropathic pain, coming for, so just 10 minutes, 5 minutes, 4 minutes, you can just go quickly through the topic, through the nice CKS, learn how to read it quickly, how to get the information out of the guidance. Because if you manage to do that with time, it will not take time from you to pick up the information or just revise the information you are looking for. Some people use a Pass Medicine textbook, which is a explanation of the answers on the Pass Medicine. It's not bad, it's good. The problem, there is some of the areas not updated frequently, but overall it's fine because it will help you, to get a lot of summarization of nice CKS, a lot of the component or topics under the condensed curriculum. So it can be helpful for you, but unfortunately it's not enough on its own because it does not cover more than 65 to 70% of what you need for the exam as a content. And you have to make sure that each topic is updated or not updated. So this is a main drawback about the Pass Medicine textbook. Or you can join the course. And just this is not the place to talk about that now, but the course, just simply speaking, I did all of that for you, okay? So if you're going to join the course, you don't need to do any of the other options or any of these steps, okay? I summarize for you the guidelines, nice guideline. If there is any topic doesn't have nice guideline, I got the guidelines from the Royal College of this specialty, summarize that for you. I went through all the previous AKT feedback report, make sure that everything mentioned in the previous AKT feedback report has been covered in the course. So the course in general is more than enough for you. You should not get worried about the medical knowledge if you will take the course, for example. So you don't need to get anything from outside the notes. And it's quite extensive, by the way. So we can talk about that at the end of the presentation if people will be interested. So this is how to build up your knowledge. If you have background, good medical background, what does that mean? You have been working in medicine before. You have been working in general practice as a family medicine before and studied well. This is mean that you have good medical background. If you are moving or shifting from other specialty, you will need a little bit more time to get prepared, okay? The ideal duration or ideal duration of preparation, ideally 6 months, ideally. You may need longer if you don't have any medical background about the general practice before or family medicine, or for example, you're coming from surgery background, maybe you may need to have longer duration for preparation. Some people who are having quite strong, solid medical background may get prepared in 3 to 4 months. So it varies, but average 6 months should be okay with good plan and dedication and definitely everyday work, okay? Regarding the exam technique, as I mentioned, so you will build up your technique through the Q banks. Again, a lot of the question come, which Q bank should I use? GB self-test is more than enough, okay? GB self-test more than enough. Put in your mind, preparation for AKT is not similar to any other preparation. It's not similar to the MRCP, is not similar to the MRCS or any other membership or Royal College exam. Why? In the previous exams, I believe most of us studied through the Q bank. So you will do Q bank, read the explanation, study the explanation, and then that's fine. It does not work in the AKT, unfortunately, okay? Why? Because curriculum is extensive, massive, and it will not be covered in any Q bank. So if you rely on the MCQ to build up your knowledge, unfortunately, it will not be the right way. A lot of important aspects, a lot of important topics will not be covered. They will be missed and not covered in all Q banks. So MCQ, Q banks, just to build up your technique. Get trained for time, get trained for the skills, how to approach the question, okay? And as I mentioned, I will share a link for that. Will not waste time talking about that. These are the available resources or available Q banks. My recommendation, GB self-test, Essential Knowledge Challenge. You will find that on the RCGB. You will have access for that because you are a member of RCGB. Innovate. Some people like it. Me personally, I don't like it. I don't recommend that. However, a lot of people found that quite good for them. I'll tell you why. So I'll tell you the story behind the Innovate magazine. So Innovate magazine, this is magazine at which recently qualified or experienced or even trainee can write in. So you can write articles, sent to them, and they will review. If they are happy, they will put it, okay? And you will find in each issue of this Innovate magazine about 5 questions for AKT. Definitely this question done by the recently qualified GBs or GBs in there, for example, ST3 finishing the exam. So that's why there is potential that some of these questions will be quite similar to the exam question. Why? Because these people writing in the magazine are not trained examiner to put question or to create question. So they will do the question or write question from what they remember from the exam, but they will just modify that to make sure that they will not get quoted for that. You got my point? That's why some people said, I did the Innovate magazine question and there's few questions appeared in the exam from what I solved it. Yeah, it's a possibility because of the reason I explained now. However, I would always advise you to review the answers against the new guidance because loads and loads and loads of these questions are out of date. Okay, so people doing Innovate magazine of 2020, 2019, 2018, 2021, all of these, there are loads of guidance changed. Okay, so make sure that you are reviewing the answer against the new guidance, not necessarily the answer they will give will be the right one. Any other QBank you'd like to use, that's fine, but it will be a waste of time if you don't build up your knowledge or put priority to build up your knowledge. So this is my advice. GB self-test, it's not the best. I'm not saying go through that because it's the best, but because the language of GB self-test is the worst one, which is similar to the exam. Okay, so it's quite stupid, similar to the exam. You will get trained how you can read the question in the exam, how it will appear in the exam, how can it be vague in the exam, incomplete. So GB self-test as a MCQ bank is quite bad, but this is the most similar one to the exams, the language. So that's why I always advise people just to do that to get trained how the language of the question will be in the exam. Okay. Essential knowledge challenge also put in your mind if you will do old one, for example, 2020, 2022, 21, something like that. Some of the guidance change it. Again, make sure that if there's any new guidance for this topic, you are following the new guidance, not the old one. Okay. Exam itself, I believe most of the people should be aware of that, but just there was some change applied to the exam starting from the last one, the October one. Number of the question have been decreased to 160 question instead of 200 question, and the time also decreased, but it's better than before because now you have 160 minutes for 160 question. Okay, so 160 question with 160 minutes, so which means that you will have one minute for the question theoretically. In the real life, it will not be the same because there are loads of the question will be short, straightforward. It will not take 10, 15, 20 second maximum. So some questions are long, you will need longer duration for, so you can compensate. In the old formation, it was 200 question in 190 minutes, which means that you have less than a minute for the question. So definitely with the new format, it should be way better. The only tricky part about that you should not make as much mistakes as before because the number of the question are less, so the passing score will require less mistakes. Okay, so roughly speaking, to make sure that you are going to pass, don't do more than 40 mistakes in the exam. Okay, so your target should be maximum 40 mistakes. 40 mistakes are too much, by the way. So the admin or organizational domain are 10 question first. Sorry, it's 16, not 10. I'm sorry. These numbers need to be corrected. Sorry about that. It's 10%, 10%, and 60%, 80%. So this is 16 questions, and the remaining will be under the clinical knowledge. Okay. So 16 and 16 and 120 something, 6 if I'm not wrong, for the clinical knowledge. So number just need to be adjusted here. Sorry about that. Okay. So I'll I'll tell you the numbers, how it will be. So 16, yeah, 16 in the admin, 16 in the clinical knowledge, and 128 in the clinical knowledge. Okay, 128, 16, and 16. Okay, just need to be adjusted. Clinical knowledge questions, again, it cover many things. Okay, or from where you can get that covered. So common chronic condition are essential. Definitely, you should not go for the exam without the guidelines or knowing the guidelines of, for example, hypertension, heart failure, atrial fibrillation, and venous thromboembolism in the cardiology. For example, endocrinology, you cannot go to the exam without the diabetes, definitely, and the thyroid, for example, okay? And you cannot go, for example, without the inflammatory bowel disease in the gastroenterology. You cannot go without the COPD, asthma, and pneumonia, for example, in the respiratory and so on. So under each chapter or under each branch, you should be aware of the most common chronic condition or most common acute conditions you are seeing or facing in the day-to-day practice. Medication, pharmacology question, very important. Why? In the last year, 3 AKT feedback report, it was mentioned clearly, 1/3 of the question of the exam, clinical knowledge part of the exam, will be related to pharmacology or therapeutics. Okay, what does that mean? It will be question about medicine, side effect, medicine interaction, medicine monitoring, indication for medication, indication for antibiotic, and so question related to pharmacology or therapeutic medication. So medication question, this consists almost 1/3 of your clinical knowledge part of the exam, okay? Picture question, roughly speaking, we are talking about, roughly speaking, not less than 8 to 10 questions per exam, at least, okay? And this is a picture question outside the statistics. Statistics have picture, which is graphs, okay? We are talking about picture under clinical knowledge. Rare important question, which is rare conditions like genetics, other condition which is not commonly presenting, such as multiple sclerosis or some other condition. So again, there are important topics, but not quite common as day-to-day cases that you are going to see. And definitely, you should not go without going through the AKT feedback report. You should not go without covering all of these topics, okay? This is some example about the nature of each question, or can be what can be tested under each question. Something, or there are something called direct questions or straightforward question or short questions. This will be massive number of the question in the exam, okay? Big number, definitely, okay? So straightforward, he ask you, for example, what are the medication or following medication or drugs that can cause elevated prolactin level, or causing gynecomastia, or causing chest pain, or causing urticaria. So this is straightforward. If you know the fact, you will answer the question. It will not take more than 10 seconds. If you don't know the fact, don't waste your time. Pick up any answer and go for the next, okay? Which of the following condition associated with Down, or which of the following is the most common cardiology or cardiovascular complication or defect associated with Down, for example? Again, if you know the fact, you will pick it up. If you don't know the fact, you will not pick it up. Be careful if the question will be written in negatively framed format, which means that all the following except, or which all the following are correct about that except, or all the following can cause that except. Always pay attention to the question and read it carefully, because you may know the fact, but you read the question incorrectly, and based on that, you will pick up the answer incorrectly. There are questions about the guidelines. A lot of them will appear, and it will cover mainly the chronic common condition, such as asthma management, inflammatory bowel disease, heart failure, and so on, okay? So for example, case of asthma in adult taking this medication not well controlled, what would be the next step? For example, okay, patient having ulcerative colitis flare up like proctitis, which medication to induce remission? So here he is asking about the guidelines. Patient having acne, patient having psoriasis, and so on. There are difficult questions in the exam, not too much to be honest, but there are few of them, and to be called a combined or judgmental question, or question depending on your clinical judgment, okay? And here there will be more than factor to decide the best action. That's why you have to read the scenario carefully, and you should not miss any piece of fact, because if you miss one of them, definitely you will not pick up the right answer. So patient having type 2 diabetes, for example, coming and the known case of CKD, his blood pressure is high, what should be done next? He's taking the following medication. So you have to read the medication patient is taking, and you have to review if there is any blood test result given or any vital signs given for this patient, and decide if his blood pressure is uncontrolled, it need to be you need to control or adjust the treatment. If patient having CKD and not taking the treatment and his ACR is high, you may consider writing for this patient, for example, ramipril, if the patient is not taking ACE inhibitor in this case, and so on. So here you will have multiple findings, multiple conditions, and then you have to read all of them. You have to interpret all of them, take a look at the condition or the patient wholly and holistically, and make sure that you are not missing any key point. These types of questions, not that much in the exam, but they are a little bit challenging. Indirect question, or 2 steps a question, we call it 2 or 3 steps a question. What does that mean? So if you got picture of child with chicken pox, so he did not say that the child is having chicken pox. He gave you picture. So here he's testing your ability to see the picture and pick up the chicken pox diagnosis. This is step number 1 in the question. Then his mother is pregnant and she exposed to the child. So here we not asking you about the chicken pox. You're asking you about the exposure to chicken pox during pregnancy, and then go for the next step. For example, asking about the management or what should be done. So a lot of question will be like that. He will give you a few steps. So you have to go through the steps to be able to answer the question. Again, these types of the question quite challenging, but not too much in the exam, fortunately. So these are example or some insight how what you will be seeing in the exam or in the day of the exam. And as we mentioned, format of the question, there are MCQ. The majority of the question will be MCQ. Extended match question, it's exactly MCQ, but giving you that on specific topic. For example, abdominal pain as a head of the question. Then you'll get 2 scenarios, each of them separate question, and the options to pick up from it will be a little bit long list of options. Okay. So here in the last exam, there was some comment from people that the options from which you are going to pick up, it was a little bit long list in most of the question or a lot of the question. So sometimes there was 7, 8, 6 options to pick up from. Free text question, be careful about these types of a question because mostly it's easy one, but at the same time people do mistakes. Why? Because people don't read what the question is asking for. For example, if he asks you about the dose of adrenaline, you have to make sure if he asking about the dose in mg or ml, for example, okay? Simply speaking. So you can calculate it in ml, or you should just, sorry, you will pick it up in ml, you write it, and he's asking that in the mg, and so on. So always read carefully what he is asking for, what is the unit for the number that you are going to write or type in the space. And definitely the picture question we mentioned about. Finally, before we finish, when should you book your exam? Again, you should not feel rushed to book the exam, okay? And this is one of the mistakes people do. I saw a lot of people, they have to do the exam because all their colleagues are doing the exam, or I would like to finish the exam early, or whatever, have been delaying my exam. I'm going to finish my training, and or I have only 1 year left and I have to finish the exam. So that's fine, all of that fine, but you have to be well prepared. The exam is not cheap, it's expensive. And believe me, the experience of failure in the exam is not good, okay? So failure experience is not that good. It can impact your confidence. It can impact a lot of things you are not paying attention for. So try as much as you can to not go for the exam without proper or good preparation, okay? Again, it's not only studying, it's not only revision. This is part of the preparation. And again, this is one of the mistakes people fall at, okay? And one of the commonest pitfall. People just read, study, I'm ready. No, it's not like that. You should be ready physically, you should be ready mentally, you should be ready from the knowledge point of view, which is revision. You should have enough time for preparation. You should have some experience, ideally. I'm not saying it's essential, but ideally. I have a lot of colleagues who pass the exam without having any single GB placement, okay? Which is applicable as long as you are going to be prepared quite well, okay? So be careful about that. I gave some example because also I did one of the sessions before about the causes of failure. We went through the causes of failure one by one, and it was quite good for people who failed the exam to watch the video and reflect on the video and know what was the defect in their condition. So sometime I'll give you examples of that. So sometime you will be quite well prepared. I have been studying for 9 months. I prepared quite well. Over the last 2 months before the exam, I do nothing other than preparation. I got 2 weeks off before my exam, sitting at home, doing a lot of preparation. I answered more than 9,000 questions. Everything is perfect, okay? And then before the exam, your son got unwell 4 or 3 days before the exam. You have to rush with your son to the A&E or urgent care. You have to be taking care of him. You was quite worried about him. So all of this preparation over the 9 months got impacted by the last 4 days before the exam. In this case, you should not go for the exam. Some people said, "Doctor, I have been studying for 9 months. I will not, for example, delay or postpone." No, I have to go. That's fine. It's up to you. But to be honest with you, these 4 days is as equal in the effects to the last 9 months of preparation, okay? You can go and fail in the exam for 3 or 4 marks because you have something happen in the last 4 days. On the other hand, it could be the same scenario, but you are the one. You got flu, you got pneumonia, you got whatever the infection you got, which affected you, make you not able to revise. And even after you start to recover, you are not fit 100%. Your concentration, your power is not the same. So this is one of the reasons that you should not go for the exam. Yes, you prepared from the knowledge point of view, but physically you are not fit. Okay. Mentally, again, it's not necessarily that you are unwell physically. Sometimes there's something happening. Maybe one of your family in home country, if you're not from the UK, having some issues going on. Okay, maybe there's something else is going on, and make you always thinking about that. Your brain is not clear about the exam. You are having something else going on. This is not the right time for you to go for the exam. Okay. Experience, as I mentioned, if, for example, you are going to attend the course, I will give you the information you need, and also I link whatever I'm explaining with day-to-day examples. So I'm trying to make that applicable as much as you can to be applied knowledge rather than pure knowledge. Okay. I have one of my colleague personally. This is something personal colleague who I know. He came from Canada because he tried to do the certificate there in Canada, doing the exams there, but he failed to find any job there. He already had the citizenship in the Canada. He is consultant obstetric. He is older than me, by the way. And then he asked me, what should I do? I told him, that's fine. Are you ready to work as a GB? He said, I have no problem to do that. On the other hand, it's quite good in the Canada to work as a GB because there are a lot of opportunities. And with my background, I will have a lot of options. So I told them, study the MRSA or MSRA and get prepared for the GB training, apply. Once you get it, let me know and tell you what you will do next. He did. And so all of that, he is, as I mentioned, he's way older than me, about 7 years older than me. He did that. He got training, and then I was with him step by step. Anyway, so just to cut it short, he came, and during the preparation for AKT, so he definitely attended with me. He was in the hospital. He didn't have any GB placement. His supervisor was quite reluctant and against him to book the exam. Definitely, you can imagine how rushed he will be because he would like to go back to his family. He don't want to stay here one single day after the training. So he would like to finish 3 years exactly, then go back. Okay. So he was quite keen to finish everything as early as possible in the training, to not have any surprises toward the end of the training or delaying him. So he told me, what do you think? Should I go? Because I got a little bit hesitant after the discussion with my supervisor. I asked him, so one question, are you following our sessions? Yes. Are you studying what I'm covering? Yes. Are you following the plan? Yes. So I told him, forget about what he said. So this guy is a little bit, having his own way. So he passed the exam with good score, and he made a problem with his supervisor. So he went to challenge him. He told him, you told me to not go for the exam, and I'm happy. I'm glad that I did not follow your advice. So which is quite stupid way, to be honest. So I told him, you should not do that. So you pass the exam. That's what you are looking for. Why you are going to confront your supervisor? You should not do that anyway, to avoid conflict in the future. But he told me because he didn't see how much he was putting pressure on me every time he seeing me preparing, even before the exam, couple of weeks before the exam, you will fail, you will fail, you will fail. So that's why I felt I have to reply that for him. Anyway, so he passed without any single experience. He is obstetrician, consultant, old, not that young. So you're talking about somebody closer to his 50s or almost approaching the 50s. So, but he just have a good structure. He has good resource to follow. At the time, yeah, definitely you can do it. Okay. But if you are going to get prepared on your own or do the study on your own, definitely you will need GB experience. Definitely. Okay. So having at least one placement or few months, 3 to 4 months in GB will be essential in this case. Okay. And as always, we always say, so study smart, not hard, and do your part, do your effort, do as much as you can, and results will be definitely from Allah. You will not pass by your study. You will pass definitely if it is the time for you to pass. But at least make your part. Okay, make sure that you do what you have to do. So this is roughly speaking, what are the requirements for you to get prepared? What are the requirements for you to set the exam? If anyone has any question, you can mention that now. If you don't have any questions, so I'm done. So definitely I will share the link for the MCQ technique. If there's any people here attended the exam before and did not pass, for example, or fail, I can share also with Dr. Khaled the link for the session about the most common causes of failure. So this session have been beneficial and good for people to get some idea and insight about what could be the cause of their failure. So if anyone has any question, yeah, I'm more than happy to respond now. So I'm taking a look on the chat. I cannot see the chat. If anyone would like to use the mic, yes, it's totally fine. Okay, so I cannot see any question, which is fine. I hope that the session or whatever I explained now was clear. I hope that there is no question because it was clear. Okay. Yes, Dr. Khaled, you can go.
Thank you so much, Dr. Omar. Thank you so much. It was quite supportive. And thank you so much for your extensive help and support to all of the GP trainees. Thank you so much for attending tonight. That's one of the most commonest, I was going to say, or one of the commonest courses that we normally recommend for GP trainees is Dr. Omar's course, because it's actually a comprehensive course. And as we mentioned, helped a lot of doctors passing through the AKT in their stages and in the GP training. So thank you so much, Dr. Omar. And now it's going to be the turn for the SCA. So now I'm going to share my screen for a second. If you bear with me. Is everyone able to view my screen and hear my voice clearly? Yes, perfect. Thank you so much. Thank you, everyone. So now I am taking you from the journey. Now you have passed your AKT, hopefully, and that's with the help and support of Dr. Omar. Now we are gonna take you into a different journey, which is actually not a complete different journey. It is a complementary journey for you to be a GP. So now we're gonna get you into the SCA. Okay, so a little bit of introduction about us in UKPASS. So what is UKPASS Medical Academy? So we have been working since 2019. We've been supporting lots and lots of doctors passing through their exams. We've been supporting doctors passing through CLAB 1, CLAB 2, MSRA, and SCA as well. In addition to that, some other postgraduate medical exams, such as AMC and etc. So our main and only passion, our main mission is actually to provide a structured, practical, and high-yield training. And the most fruitful thing of all of that is actually to get you to pass your exams in a very good score. But imagine this is not the main thing. The main thing is that we would like you to be a better doctor as well. It's not only to pass your exam, but also to be a very good GP. Okay, now let's continue with our session. Now let's talk about the main thing for today, which is SCA. Right. So understanding the SCA exam now, imagine you have completed your AKT and now we're going to go through the SCA. So what is the SCA? Simulated Consultation Assessment, which assesses a GP candidate ability to integrate and apply clinical and professional and communication skills. Now, AKT knowledge is very important for you to prepare, but when and how to apply that is when you go through the SCA, which is very, very important. Knowledge, build this up with the AKT. Take this knowledge and apply it in the SCA. So the SCA is designed to reflect a real life general practice. and objectively assesses the skills required for a competent GP consulting. So very important. We would like you to be a competent GP, and it's not only about gaining and taking knowledge, but it's also about how to apply this knowledge. And this is what the SCA exam assesses. Right. So SCA exam format. So what is the SCA exam format? 12 consultations, 12 minutes each. Also, you need to know about there is what we call reasonable adjustment, and we're going to have a chat about that in a minute. But mainly 12 consultations and 12 minutes each. So simulated patients, they are professional role players. Professional role players. If any of you been through the CLAP exam, so the professional role players who are wearing the CLAP exam, CLAP 2 exam, then you can actually find similarities in this exam when it comes to the professional role players. Some consultations are audio, some others are video as well. So audio consultation meaning as if you are doing a telephone consultation from your GP practice. Before you start your each case individually, you have 3 minutes reading time to start before you start the case. So 3 minutes is very important time because you need to read the case very carefully before you start your consultation. Every single thing in the notes is very important. Please pay attention to the notes. Physical exams are not assessed, so they are covered in the workplace-based assessment, so you don't have to do any physical examination in the SCA. Now, what is the exam blueprint? What is the SCA curriculum? So, as Dr. Omar mentioned, there are lots and lots and lots of, curriculum points in the AKT. There are actually 12 criteria, 12 clinical experience groups in the SCA. Right, so things like patients less than 19 years old, gender, reproductive and sexual health, long-term conditions, older adults, mental health, urgent and unscheduled care, health disadvantage, ethnicity, culture, diversity, prescribing, investigation results, professional conversations, professional dilemma. Go through all of that in your spare time. Read it very well. You need to cover the whole domains when you are preparing for SCA. This is very, very important. Now, applying for the SCA, when to apply? So ST3, beginning of ST3 and above, very important to start preparing for your SCA. Actually, if you are approaching ST3, if you are, by the way, at the end of your ST2 and you have completed your AKT, you can still start preparing for your SCA. The earlier the better, but also please go for it whenever you are completely prepared. I'm going to have a chat about that. By the way, you can still go for the SCA before going for the AKT, but it's important to go for your SCA once you're done with your AKT, once you're done with gaining your knowledge. This is very, very important. Okay, so key points, only set when you are ready. So when you are ready, so how long should you be preparing for your SCA? It actually really varies. Dr. Omar mentioned about the AKT, everyone is different. However, in the SCA, some people take a longer pace of doing the SCA. Some people actually tend to study the SCA in as short as 3 months' time. But I would really, really recommend doing it for at least between 4 to 6 months' time. Give yourself time, give yourself good amount of time preparing for this exam because it is not a cheap exam. It is not a cheap exam. We're going to have a chat about that. Right. You also could have a chat with your supervisor. Your supervisor, very important, have a chat with them because they are the ones who actually are seeing you on a day-to-day basis. They can actually give you very important advice on when you can sit for your SCA. Exam dates and times. Unlike the AKT, there are 9 settings of the SCA per year. 9 settings, okay? So that's quite a lot of amount of exams per year. You can actually reserve your exam up to 12 months in advance. So you can reserve it, but you can book it 7 weeks before the exam's date. So you can reserve it on 14 Fish up to 12 months in advance, but you can book it 7 weeks before. Okay, so reservation is not like booking. So you can just click on 14 Fish, just reserve it, and then book it when it is available on the website. Right, location, technology, taking at your local GP surgery, and it is an online platform called Osler Platform, okay? Local GP surgery. Most candidates will sit the exam in their own surgery. IT requirements are supported via deaneries and things, so don't worry too much about that. Examination is recorded and marked later by an independent examiner, okay? So pay attention to that. Your exam is recorded. Whatever you say in the exam is going to be caught on camera, is going to be recorded. Then an examiner is going to review that independently later on. Each consultation is marked by a different examiner. Okay, so know that very importantly. Each consultation of the 12 stations that you are giving is marked by a different examiner. So it's not the same examiner who is going to mark the whole of the 12 cases. Reasonable adjustments, as we have promised. So this is a very important thing. Please bear that in your mind. What is reasonable adjustment? If you ever have any neurodiversity, things like ADHD or ASD, for example, or if you have any disability or chronic health conditions, this is a very important thing to bear in your mind, that you need to contact the RCGP very good time beforehand. Every exam style, they have a reasonable adjustment deadline. So very important, put that in your mind, because you might get an extra time in your exam. You might get additional reading time, longer consultation time, and you can also take extra breaks, okay? Some people actually tend to have some, accessibility features like keyboard-only navigation, zoom, enlargement, of the instructions in the exam as well. So that's something that's very important to bear in mind. Exam fees, as we have mentioned, is not a very cheap exam. So it's around £1,200. So please go for it only when you feel that you are really, really prepared. So now, how to understand the exam's marking. This is also a very important point. How to understand the exam marking. How are examiners of the SCA are marking you against? Now, data gathering and diagnosis. This is a very important thing. So data gathering, you have 3 domains: data gathering and diagnosis. The second one is relating to others, which is actually what we call an interpersonal skills, and the last one is the management part. So data gathering and diagnosis, what the examiners want to see while you're taking information from the patient and translating that into management. So data gathering, you need to ask right questions. Not all questions need to know the differentials, but you don't have to ask all of the differentials on earth, so the most common differentials. You need to have a clear structure and exploring red flags, psychosocial context, and the patient's existing record. If a patient is having some records in their notes, please reflect on them and don't ask questions that might sound that you haven't read notes perfectly. So this is very important. For example, if a patient is a smoker and in the notes is being mentioned a patient smokes, a patient drinks alcohol, so don't ask them whether you smoke or you drink alcohol. Instead, you can say, I can see from my notes that you do smoke 15 cigarettes a day. Is that still the case? I can also see that you drink alcohol per weekend. Is that still the case? Right? So this is very important. Reflect on notes in your data gathering. Generate sensible lists of differentials, as I've mentioned. Update your thinking as the case unfolds, and handle uncertainty appropriately. So very important, bear in your mind, uncertainty is a part of you being a GP. Being a GP, you are very expected to deal with uncertainty. Unlike a hospital doctor, in hospitals, you actually have different facilities, but in GP, you only depend mainly on your clinical judgment. So this is very important. If you are in an uncertainty case, speak out loud. Tell the patient that it might be this, it might be that. You are thinking about differentials here whilst you are going further with your management plan. Right. Clinical management, medical complexity, what the examiners want from you, very important. They want to know whether you are safe or not. So being safe, that's the main thing in the management part. Being safe, okay? Being safe actually means that you need to use evidence-based management. Tailor the plan according to each patient individually. This is very important. So, for example, if a patient doesn't smoke, if a patient drinks alcohol, so don't just say, I advise you to stop smoking. I advise you to stop alcohol. Your weight is on the higher side, so I advise you to lose some weight. No, how? This is the most important thing. How to ask the patient, how to give the patient advice that is really tailored to them individually. So, for example, if a patient is like a lorry driver, how to advise them to reduce, the amount of junky foods that they are eating, for example, batch cooking, etc. So, very important to tailor the plan according to each patient individually. This is very important. Good safety netting. Being safe is actually to give very good safety netting to the patient. Follow-up and continuity of care also very important. By the way, safety netting is very important to know how to safety net the patient. It's not about if symptoms get worse, please seek medical advice. No, this is not the case. You need to tell the patient, you need to safety net the patient before they go, and that's how you can be a safe doctor. Because remember, you are a GP. Being a GP, you don't have all facilities. Your diagnosis might go wrong at some point, and patient might need to go to hospital. But it's your duty to tell the patient when to seek help. Perfect. Ability to judge multi-morbidity is very important. Safeguarding and polypharmacy as well. All of these are very important. Very important. We've talked about before when to suspect a safeguarding issue. This is very important. Managing uncertainty, as we have mentioned, this is a very important thing. Speak out loud. Tell the patient, it could be this, it could be that. It's a dilemma here, right? So very important, manage uncertainty. It is really expected from you as a GP to know how to manage uncertainty. Okay, so a clinical management part, this domain actually carries the most weight. So 4.5 marks. The rest of the domains are out of 3 marks, okay? So data gathering is for 3 marks, interpersonal skills 3 marks, management part is 4.5 marks. So this domain is the most weighed domain. So pay attention to that. Perfect. Now, moving on to relating to others or interpersonal skills, what the examiners want to hear from you is being patient-centered, empathetic. This is very important. Also, understanding the patient's agenda, beliefs and values, ideas, concerns, expectations, very important. Very important to show the examiner how you are gaining what the patient's agenda is and how are you actually reflecting on the patient's agenda, ideas, concerns, expectations. Very important. You need to use clear explanation, layman language, avoid any sort of medical language. This is very important because at the end of the day, you are simulating you speaking to a patient. You're not speaking to the examiner. Okay? Very important. Of course, respect the patients, know the cultural awareness, ethical practice, and be a very professional doctor during this exam and actually during your real day-to-day life. Now, very important topic, essential SCA exam resources. What are the resources? So there are different resources. So let's talk about the RCGP resources. So they offer paid courses and free SCA webinars, and all of these resources are really available on the MRCGP website. You can go through them and you can have a look. Some of them are really pre-booked good time in advance, like 4 or 5 months in advance. So you can find some of the paid courses, but also some free SCA webinars. I leave this slide for you to take a look in the future if you would like to. Now, how about UKPASS? What do we offer to you? What we do offer to you is that we offer what we call an extensive high-yield course. So what is the extensive high-yield course? Extensive high-yield course is what we call a 12-session course. So that's actually a course that's run on 2 weeks' time. So this is a very important course because we go through all of the essential SCA topics and we go through them in a very impressive way. Why? Because we go through all of the topics in a story-like way. First of all, because that actually makes you remember how the topics actually present in real day-to-day life. So 2 weeks course, this is very important, and that actually covers all of the topics. So this is perfect if you have a strong and reliable consultation frameworks. If you would like to get that, deep understanding of the core conditions, real clarity on the RCGP examiner expectations, gives you confidence and certainty going through the exam. So this course is designed to deliver one thing: clear, structured path to a safe, clear path in the exam. Right, so what is a rapid course? So this is an intensive high-yield course. So if you are short of time and you'd like to go through, the exams topic very quickly, so this is what we offer, 8 days course. So that's actually something that's very good and very concise, very rapid, and helps you. And all of our courses comes with video recordings and audio recordings, and also notes as well. So these are very good resources for you to prepare from if you are going through the SCA exam. Okay. So our notes, by the way, if you haven't had a look, I would highly advise you to have a look through them. They are very colorful. They are very concise. They are very organized as well. Right. Management Summeries Course. So this is one of the courses which is a very highly rated and also important, and it is a final revision course if you are going through the SCA exam. Highly recommend, specifically if you are approaching your SCA exam, this resource is a gem actually, and the Management Summaries course gives you very good infos as a final revision before you go to the exam. So you have the extensive course or the rapid course, and then before your exam, go through the management course, which is a final revision gem. Actually gives you very important information. This is perfect for final stage revision if you would like to refresh all of the management plans, and we have hundreds of very perfect reviews when it comes to all of our courses. Right. Okay, so what are the other things that we do offer? And we do recommend, actually, mock exams are very important. So mock exams give you ways of, being realistic. So this is very important because you are practicing what you have gained. So it's not only about gaining knowledge, but also, as we've mentioned, applying this knowledge, because it's very important and improves your consultation and actually get a feedback, which is a constructive feedback and an honest feedback. This is very important. So we have 3 types of mock exams. So 3 cases, which is perfect if you are a beginner. And this is a great way to identify your strengths, spot early mistakes, and get instant focused feedbacks. Okay, so these are important. But how about the 6 cases? So these are the most popular options, because actually many doctors go through the 6 cases of the our mock exams, and they are quite helpful and supportive. And these are actually like many exams as well. So all of these are important. Now, the 12 cases is it actually resembles the exam situation, ultimate SCA rehearsal, through exam length simulation, which is very important. And we also do that specifically in the final weeks before your exams. Also, each mocks contain live simulated cases, time-structured, detailed feedback, and targeted actions to improve your score in the exam. Also, we run interpersonal skills workshops, because also it's important to, as we mentioned, to apply the knowledge, but to apply it in a very good way and actually use your communication skills to boost your SCA performance. So this is very important. Okay. Now, moving further to top 10 tips for success in the SCA exam. So timing is everything. Timing is everything. Knowing when to set for the exam, as we've mentioned, is very important. As we've mentioned before, everyone is different. Many doctors tend to go through the exam after maybe 4 months' time, 6 months' time. I personally know many doctors went through the exam after studying, preparing for almost a year's time. So very important to know where you are at the minute. And how to know that is by doing some mock exams to understand when should you be doing your SCA. Also have a discussion with your supervisor about that. Secure your slot early. Okay, so very important, because as we have mentioned that the slots of the SCA might be reserved very early. So reserve your slot very early. Can be done up to 12 months in advance. Practice. This is the main sincere advice for me, for you, actually from my side. So practice. This is very important, because how to apply that, this is the main thing, and how to apply that in a very good way. You will never do that until you really practice with your colleagues, practice by doing mocks, practice while it's actually you are in your day-to-day GP setting. Now, number 4, make changes gradually. So introduce one phrase or one technique at a time. So imagine you are in a busy GP practice every day, you see many patients every day, and you think that you will be able to apply the whole consultation techniques. If you are having maybe 15 minutes consultation, it's very difficult to apply all of your structures in every single patient that you are seeing. So how can you do that? So for example, if you're seeing, the first patient, I'm going to apply ICE, for example, in a perfect way. The second patient I'm seeing, I'm going to apply data gathering techniques. The third patient, I'm going to apply the management plan techniques and structures. So very good to practice that while you're seeing your patients, but it's very difficult to do all of the consultation skills in every single patient individually. Okay, so because as we have mentioned in the SCA exam, they are trained role players. They are not going to waste your time. And mainly they are coming because of one problem, but in real life, many patients are coming because of a few problems. Okay, so put that into your mind. So practice timing, very important. Don't just practice without using a timer. So using a timer is very important. 12 minutes. 12 minutes is very important whilst you are practicing with your colleagues. Right, recharge and reset. So some practice days will be tougher than others. So take breaks and reset. So you don't have actually to practice every single day, but if you can, at least do that maybe twice a week, 3 times a week, at least. This is very important. Keep the ball rolling. This is very important. Prepare the team months before. So inform your practice stuff about the exams day. So very important, because there are lots of things and we can have a chat about that We have done a session before about the exams day, but we can also do that at some point. So really important to let your practice know when you are going to set the exam, because there are lots and lots of preparation. Actually, the most important one is to allocate a room for you, so that you know which room that you're going to have the exam in, and actually do all the preparations of this room before going through the exams day. Store the details days before exam. Complete a virtual connection check and ensure your computer setups meet the RCGP regulations. Exam day essentials. All of these are very important. So what are the exam day essentials? Login details, room setup. You know, there's what we call exam in progress sign, and this is a link that you're gonna get before your exam. Clothing, like scrubs, are all fine as well. Patience. So celebrate completing preparation and the exam itself. After you finish your exam, you will feel a lot of relief, okay? So because actually going through the exam itself is a very, very stressful situation. So once you're done with your exam, even before waiting for your SCA results, you're gonna feel a much better relief, actually. So exam day, we're going to have a chat about that in detail at some point, but not today. So exam day, what you can do, you can bring some food, drink if allowed, stay calm. The SCA is a simulated assessment. It's not a real life scenario, okay? Focus on reading notes very carefully. So this is a very important thing. Read notes very carefully. Don't overthink role players. They respond to your approach, okay? So very important, very important. Don't overthink in the SCA. Reruns happen as well if there is any problem with your case, specifically internet connection errors, but there are some criteria for that. We will go through that at some point. But then, yes, you can have up to 3 rerun cases per your SCA. Okay, so some cases, if you have a difficulty in connection, for example, they can be rerun at the end of your exam. Now, what are the key takeaways here? Plan ahead, as I mentioned, reserve early, book 7 weeks prior, be ready, only set when you are confident, communicate, discuss timing with your supervisor, very important, speak to your supervisor, check adjustments, apply early if needed to ensure fairness and accessibility. As we have mentioned, reasonable adjustments are very important because they can give you some extra time, in the consultation, or it can give you extra time reading the case, but that only depends on whether or not you have neurodiversity or disability, as we've mentioned earlier. Now, very important, I get asked this question on a day-to-day basis. Why people, not pass the SCA exam? Why people actually fail to pass the SCA exam? So, failure to demonstrate safe practice. As mentioned before, you need to show that you are a safe doctor, okay? Don't miss any red flags. Don't miss any red flags while you're speaking to your patient. This is very important. Poor risk assessment, weak safety netting. We've mentioned before, not that you have said, if symptoms get any worse, please get back in touch. No, you need to tell the patient how to use safety netting in a very appropriate way, okay? So safety failures are the most common causes of failure, okay? Poor data gathering, because basically if you don't get enough data gathering, you'll not be able to have a very good management plan. So very important, don't miss the psychosocial factors. You are a GP, you are not a medical doctor in hospital. So you are a GP, you need to know about the patient's surroundings, the patient's circumstances. You need to know the patient's home situation, work situation, what do they do for a living, what is else at home. Rushing the history. So don't just rush the history to go into the management without asking important questions, like red flags, as we've mentioned, differential diagnosis, okay? Jumping too quickly to the management plan. All of these can actually lead to, unfortunately, failure in data gathering. And actually, that can affect your management plan as well, because if you don't get good data, you'll not be able to get a very good management plan. Ineffective communication, so talking too much, interrupting your patient, using medical jargons, as we've mentioned before. Try to make the language as easy as possible. Remember, you're dealing with a patient, you're not dealing with the examiner. Not checking the patient understanding. For example, if a patient has been diagnosed already with diabetes and now you're going to the management plan, you are not checking how much do they know about diabetes, for example. You are not actually checking with the patient whether or not they are following you, if they have any questions. So very important, check understanding when you are speaking to the patient. It's not a one-way, it's not a mini lecture. So this is a very important thing to bear in your mind. Right? So missing empathy or failing to build rapport. So imagine a patient coming to you and telling you, doctor, my mood is not so great. And when you ask them, why do you think it's not so great? They tell you, oh, doctor, it's just because my dad died a few weeks ago. And then you say, okay, and tell me more about, do you have any stress at all? So no, where's the empathy here? You need to be very empathetic, okay? I'm really sorry to hear about that. And please let us know if you need any help or support. And we are more than happy to help and support you in your situation. So show empathy. It's very important. Build rapport with the patient. Right. Weak clinical management, not offering evidence-based options. So this is very important. Use the CKS NICE guidelines. So all of these are very important. Don't use your local guidelines. So we rely on the NICE CKS guidelines. Okay, so this is very important to bear in your mind. Missing safety netting or follow-up, as we've mentioned, poor shared decision-making, one-way consultation, over or under treating. Okay, so patient, if you, for example, patient coming to you today and they are having a specific medical condition and there is a psychosocial also aspect for it, and you are just dealing with a medical issue and you're not dealing with a psychosocial issue, so this is an incomplete management. So you need to pay attention to that as well. So management that is unclear, unsafe, or not person-centered results in low marks. Right, not adapting to the case. Final reason is that you're not adapting to the case. So treating every case the same, not responding to cues or complexity. So we mentioned before, there are things like verbal cues and non-verbal cues. Okay, so verbal cues are the cues the patients are giving to you. Non-verbal cues is that if the patient is actually like looking sad or looking angry, you need to respond to that. I can see that you look anxious to me. I can see that you are unsettled, for example. So giving these cues and reflecting on these cues is very important. Some actually under the exams pressure, sometimes you tend to freeze, or, you get like a mental block in the exam at times as well, which is fine, but it's very essential to also move on as well, okay? So the SCA rewards flexibility, not a script. Do not assume things. This is my sincere advice to you. So don't assume things. Don't assume things, okay? So please be flexible. Don't think that you are, for example, why the patient is coming today. No, you need to ask. You need to ask the patient. You need to gain the patient's whole eyes. Don't assume that, why the patient is here today. No, you need to gain information from the patient. This is very, very important. Now, imagine if, for example, I hope you all pass your exams, but of course, that's an exam. What is an exam? So exam meaning that there is a percentage of people passing, percentage of people not passing or failing the exam. So very important to bear that in your mind. What happens if I don't pass my SCA? If I don't pass my SCA, this is not the end of the world. You have a few other attempts to go through, and hopefully if you don't pass in the first attempt, you pass in the second attempt, okay? So don't panic in case if that happens. What do you need to do? Treat it as a feedback, not a verdict, okay? So SCA result is not a measure of how your work as a doctor. So this is very important, okay? So it doesn't mean if you fail the exam that you are a bad doctor, for example, no. But it's a snapshot of your consulting on that day, okay, and the format. So shift the focus from why did I fail to what can I learn from this and move forward. Okay, so this is very important. Again, passing or not passing the exam is not a very good measure of you being a good doctor or a bad doctor or anything like that. Okay, so we are all learning. Every day is a learning day. Right, understand your performance in detail. So break down the feedback domains. Go through the domains that you're getting from the exam. So data gathering, did you miss cues? Did you rush, for example? Did you explore the patient agenda? As we mentioned before, this is very important. Clinical management, where your plans are unclear, unsafe, or not patient-centered, as we have also mentioned. Okay, so how about interpersonal skills? Did you build up rapport? Did you show empathy? And did you check understanding with the patient? If you don't do that, so take that opportunity, take that chance, and build it up, and move on. This is very important. Move on. Think about the next exam. Right. So failure pattern as well. Sometimes you tend to find that there is a specific pattern that's happening in your exam cases, for example, or whilst you are practicing with your colleagues. So talking too fast or too much, not clarifying the patient agenda, missing red flags, we mentioned overthinking or freezing, appearing rushed or robotic. Naming your pattern helps you fix it. So you need to know, you need to understand what is the pattern, what do I do? All of us have things that we don't know until we, capture that. So I highly advise you to do some video recordings. Video recordings whilst you are practicing with your colleagues or whilst you're seeing patients. All of these can actually help you understand what kind of patterns that you tend to do, and that's how you can work on them. Otherwise, you will not be able to know. Also, to do mock exams, all of these can help you actually build a very good structure. Okay, so build a targeted improvement plan. Don't try to improve everything at once. Okay, choose 2 to 3 focus areas and work on, deliberately. Use deliberate practice during real clinic sessions. As we mentioned before, if you didn't do that before your first attempt, which I highly recommend to do before your first attempt, is actually try to change things gradually. Don't rush to change everything all at once, because that might lead to not changing anything at the end. Right, practice with accountability. Okay, so as we've mentioned, review recorded consultations with your supervisor, role play. So very important, whilst you are role playing, role play challenging scenarios. All right, role play challenging scenarios. And this is not the only thing. Also, I highly recommend, whilst you are practicing with your colleagues, I highly recommend that you do that in a very, very effective way, and also try to challenge each other. Try to challenge each other during the consultation, and that actually will help building confidence in the exam. So know that confidence often improves after a fail. So it's not because you have failed, as we mentioned, it's the end of the world. If you have failed, this means that there is an area of improvement which we can act on, and that can actually give you very good confidence. Yes, many people after exam failures, they tend to lose confidence in themselves, but I don't want that to happen, because as we've mentioned, we learn every day. It's not a matter of being a good doctor or not a good doctor, but it's all about that there are areas of improvement. If you act on them in a very clear way, you're gonna get very, very good results during the following attempt. So very important as well, well-being. Okay, so as we've mentioned, if that happens, so failure hurts, give yourself some time to proceed, and also have support from supervisors. Take some time for yourself as well. This is very, very important. Okay, go back stronger. When you return to the exam, you will understand the format deeply. You will have fixed your weakness points and areas of improvement, and that will give you a very good experience as well, and that will give you very good confidence in the SCA. In summary, very important, choose the right time. As we've mentioned, this is major part of your SCA preparation. Choose the right time. Secure your slots early. Practice strategically. This is very important as well. Practice the right way. It's not about practicing only, but also practicing the right way. And this is what we offer in our mock exams as well. Master your timing, very important. Whenever, as we've mentioned, you are practicing, very important to set a 12 minutes timer. focus on all three domains. So very important. It's this exam, the good news is that you don't have to pass or to fail certain amount of cases in order to pass or fail this exam. No, this exam is all about marking. It's all about marking. Has your mark actually exceeded the pass domain? Has your mark hit the pass target? If so, this means that this is a very good opportunity for you to pass the exam. Okay, so why I'm saying this? Because it's very important. So for example, if you have a challenging case and you think that you didn't do very well in the exam, and then this can affect the following case, the following scenarios that you're getting in the exam. Okay, so you might be surprised after coming out of the exam of the case that actually you do, or you did things that you didn't do very well at. You might be surprised that you have passed this case, but because you were very, very worried and you were overthinking about the last case, you might not pass the following case because of that. Okay, so treat each case individually. Actually, treat each domain individually, because this exam is all about gaining marks, as much marks as you can. Right, use high quality resources, and we've mentioned MRCGP resources. We've mentioned about high quality UKPASS resources as well, as we've mentioned. Prepare your environment before the exam. Stay calm and reflect after the exam results. And then I hope we congratulate you all after passing your SCA exams in the first attempt. And I hope you all gain a very, very brilliant future. After you pass your SCA exam, then you're going to have a chat with your supervisor about your CCT and everything. But again, as we've mentioned, if things happen, you don't pass your exam, don't panic. It's not the end of the world. It happens. And there are areas of improvement. And I don't know anyone who didn't pass the SCA, even though after first attempt, second attempt. And also, I know like a person who managed to pass their SCA at the final attempt. So there is always hope. There is always hope. Now, have we got any questions? Anyone has any questions for us today? If you have any question, please feel free. You can open your mic and ask us, and I'm more than happy to help and support. Perfect. So if we haven't got any questions, so this is also a good thing that, yes, sorry, Dr. Osama, he said, how long is the extended SCA course? Is it in 2 to 3 months' time? Yes, so the extended SCA course, actually, you get 12 weeks, which is actually 3 months time access. So that's actually something that's very, very good, which is actually a very good privilege, because, as I've mentioned, most of the doctors go for their SCA after preparation for 3 months' time. So it's a very, very good course. Actually, I would highly recommend combining it with the final revision course, which is a management summaries course, if you are going through your SCA as well. So you get the whole clear pass combo. So this is a clear pass combo. Gain the information, gain the knowledge at your own pace, at any time you can do that. So you can do it in the morning, the evening, at your free time. You have the full access to notes, full access to video recordings. If you have ever missed anything, you can go back, listen to the recording, see the video recording, so that can actually help building your confidence in the exam. Same as for the management summaries course, so that's a 12 weeks access as well. Access. Perfect. Any other questions? Any other questions? All right. So thank you so much all for joining us tonight. I hope you enjoyed our evening tonight. We've talked about things like how to pass your AKT in a very, very good way, and also how to pass your SCA in a perfect way. This is a very important alliance between myself and Dr. Omar. We are all hoping to get you past AKT and SCA in just no time. If you follow our advice, we can guarantee you're going to pass your AKT, your SCA in a very perfect way. and from the first attempt as well. Thank you so much all for joining us tonight. I hope you all have a nice evening, and we'll see you all later. Thank you. Bye-bye.